Good Wonderful. Yet we will be recording the meeting and everyone will get a copy. Everyone who signed up, some who may not be here, but want to welcome you. We want to thank our host, Senior and Disability Action of San Francisco. Grace, thank you. Lihia, thank you so much. And we also want to thank our organizing team, especially Steve Seltzer, for recruiting the labor panelists this evening. The title of tonight's teach-in is The Attack on Healthcare Workers and Patients and the Fight for Single-Payer Healthcare. Our panel of healthcare workers will report on the looming cutbacks on healthcare workers and their unions and what this means for patients and communities. Dr. Anna Malinow will close, reminding us that only a national, single-payer, improved and expanded Medicare for all, free from profit, can fix this mess. Our format tonight, first, I'll introduce our panelists. Each panelist will speak about 8 to 10 minutes. Time permitting, we'll close off and have a question and answer session from you, the audience. And you can ask whatever questions you have on your mind, so jot them down as we go through the evening tonight. The five panelists include Brenda Barros, SEIU 1021, San Francisco General Hospital Chapter Chair on the conditions at San Francisco General Hospital. Next up will be Elizabeth Milos. She's retired interpreter at UCSF for 18 years and a member of the University of Professional Technical Employees, UPTE CWA 9119, and now a member of CWA Retiree Council and the UPTE Members for Palestine. Next will be Cheryl Thornton, SEIU 1021, San Francisco City Community Healthcare, Delegate for San Francisco Labor Council and Staffing and Healthcare Crisis. Desireee Rojas will then speak. She's the past president of the Labor Council for Latin American Advancement in Sacramento. And she'll talk about immigrant workers and how they're being affected by the healthcare cuts. And then last, Dr. Malinow, retired clinical professor of pediatrics, UCSF, National Single Payer Steering Committee, and she will talk about National Single Payer. So I'm turning the microphone at this point over to Brenda. You're up.
Hello. Sorry for the background noise on the car, like I said. But what's going on with us is multi-tiered. One of the issues that we're having is because of the federal cuts related to healthcare, that the budget for the Department of Public Health is in jeopardy. Up to the tune of $400 million. So what we have decided to do is we have a campaign that we start, which is Stand Up San Francisco, which is going to be a CEO tax. So our union, and along with Local 21, collected the signatures, are going to put it on the ballot, and that will help decrease that amount. But the basic problems with healthcare, what I see with relation to the coverages that people can get, how people fall on and off coverages, it is not patient friendly. The current system in place is not really patient friendly. We do what we can, but it's really not patient friendly. I'm in patient access, so the specialty clinics is where I work. And we see the need. The needs are growing, but the access is becoming an issue. So I think that, the reason I support this, I wasn't always a supporter of single payers. I was one of those people like, it's going to happen with our jobs, blah, 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 blah. But now, I've come to the conclusion that unless we have a system like that, or some sort of system like that, the details can be worked out for the workers. And the costs that is employees that we see on our membership. We constantly get threatened every year with, it's going to go up, it's going to go up. We got to have these drastic cuts. We've given up pay wages to protect certain things within our healthcare to maintain our current, what we have. But it's really, really bad. And for the private sector, it's really even worse. The values and the things that we get and our benefits, and we're some of the fortunate people. We have pretty good coverage and pretty good pensions and all this stuff. But we see a lot of our clients who come, they don't have that. And some of them work every day. There's no reason that they should not have good health insurance. And so I'm in support of this. I'm here to support that issue. Our union has taken a stance on that for a long time ago. We have a committee within our union that's about single payer. One of our old members that's been around a long time, he's now retired, Ed Kenchley, is still leading the charge among the retirees because we know that, it's going to have a drastic cut in the system we're in, and it's going to have an impact on all of us. It's going to have an impact on our wages. It's having an impact on the health of the people who actually do the work. We're dealing with issues of psychological harm being caused to workers and that leading to physical harm coming to workers. And it's growing, and we hear more and more about strokes and what all these different things that are happening to our workers. And a lot of people, including me, I'll have to be honest and full disclosure. Do I go to the doctor like I should? No, because I spend all my time fighting for people. That's where all my time goes. So I don't even have time to take care of myself. So that's where we are. That's what I'm hoping that through meetings like this and other issues that happen, that we can start moving forward with this. But there's a lot of resistance out there, even among our membership. We've been trying to educate for years, and we will continue to do that. But ultimately, we need to have a single payer system that takes all this other stuff that people have to do, the rationing of healthcare, all that off the table. So that's what I'll say tonight. Thank you guys for listening.
Thank you, Brenda. We really appreciate you sharing your personal journey with us and your transformation to the belief in single payer. Next up, we've got Elizabeth.
Hi. Yes, I was a medical interpreter at UCSF for 18 years, as you mentioned, also a member of a union, helped organize the medical interpreters throughout the state of California of UC into UPTE in 2009, and was participating regularly in all the strikes and things that had been going on since then. One of the issues of the strikes was that UC was also trying to undermine and take away our pensions. Brenda mentioned something about our having good pensions. Many people think there is this concept about pensions as if their pensions are not all workers have pensions. Very small percentage of workers have pensions. Some workers have what's called also individual retirement plans. I'm calling attention to this issue in particular because one thing is to have a defined benefit plan where there's an algorithm that defines based on your 3 highest years of earnings, your age at retirement, and the years of service, and you know how much you're going to get, right? And it's shared risk. Some unions have pensions where they have actual union representatives also defining how the money is to be invested. And but individual retirement plans, there's an individual risk. It's an individual, and of course you have the situation where it's a defined contribution. You know how much you're putting in, but you don't know how much you're getting at the end. There is something that the reason I'm mentioning is this because this is a very typical neoliberal model that was first tested on Chilean workers after the dictatorship. They basically put a gun to their head and said, you got to accept this, okay? The individual retirement plan. And 35 years later, public sector workers got the very short end of the deal. Teachers and hospital workers in particular ended up with starving wages, 1/3 of poverty level wages, pensions, basically, as a result of the retirement, these individual retirement plans. It's called AFPs. Our union, in strike after strike, we were trying to protect those, okay? There were several issues also. In our union, we used to have a health and safety committee. After a new leadership came in 21, we no longer have health and safety committees. We used to have a peace and social justice committee. Part of the work that we were doing in peace and social justice was educating our workers about different issues. I was also a member of the San Francisco Labor Council, and I was with Cheryl and with Brenda there when we tried to present a resolution on Palestine in 21, when the Palestinians were being massive families were being kicked out of East Jerusalem, and continued ethnic cleansing was going on. Now, I also have to mention that within the San Francisco Labor Council, we were dealing with members and leadership, union leadership and union bureaucracy that were against any kind of talk about Palestine. And the reason why I mentioned pensions first is because our unions are directly linked to the privatization also of Medicare. They've proposed Medicare Advantage, which basically gives less support for retirees and less support for retired workers than what would Medicare be. So this is part of the continued definancing of public spaces and public sector and safety nets for people, both for healthcare workers as well as for the patients together. During these different strikes that were going on, people started connecting the dots and realizing, okay, apparently University of California is investing in Israel, while in Israel, by the way, has universal health care. Okay. And if you look at the website called Not My Tax Dollars, you can see that in 2024 alone, there was $17.9 billion. That's not even including the weapons, but $17.9 billion that could have financed more than 6 million children's health care in the United States. And the pensions also within our own pension plan funds that we don't have control over at UC, other unions have control over theirs. We are investing in companies such as Lockheed Martin, such as weapons companies, surveillance companies, as well as financial capital companies that are using our money to finance campaigns against single-payer healthcare and against rent control. Anytime we put something on the ballot to try to get rent control in California, for example, which was Measure C, we had $60 million. I think at that point, I think was much more than that, by the Johnson Foundation that was funding it against us. The same thing happens with single payer. A lot of these foundations and a lot of these groups that we are investing in our own retirement accounts through Fidelity and all that are basically we're funding our own opposition. So something's got to give here. We have to be willing to connect the dots. The healthcare in this country is to such an extent so broken that we happen to be paying much more in healthcare and getting and we're at the bottom level of any industrialized nation in terms of the quality of healthcare that people are getting, and people are dying at a higher rate. And also, I mentioned the Health and Safety Committee of UPTE in particular was because we had a social worker who was killed in the function of his job duties. That as a result of the fact that we don't have a health and safety committee, even though social workers and other workers had been complaining about problems of safety there at San Francisco General Hospital, which is also partially run with UCSF. So they were UPTE members that were working there, that are working there, and they weren't heard. They were not heard. And UPTE is the national, the statewide union that represents 22,000 workers, health professional and technical employees that include basically anything from psychologists to physical therapists to people that work in IT workers, as well as research coordinators in the state of California, 22,000 of them, as well as medical interpreters and pharmacists, a whole range of workers. And nationally, we are part of the Communication Workers of America. So I attended several conventions throughout the time that I was working at UCSF. Some conventions that we were able to get passed, some resolutions that we were able to get passed at the conventions. One of them was the Laguna Honda resolution that we tried to bring to the San Francisco Labor Council, and which was not even taken up at the end. It was not even taken up. It was during the time when they were trying to close Laguna Honda and transferring patients, elderly patients out, and the patients that were being transferred out were dying, actually. So we took a stand and we did rallies, but the Labor Council itself did not take that issue up, and they stalled basically. We also did as a delegate of the Labor Council, Brenda and Cheryl and I and a whole bunch other groups of delegates, we tried to bring a resolution on Palestine in 2021, which was shot down by members of the Labor Council who were open Zionists and AIPAC supporters who have spoken at AIPAC conferences, in particular Olga Miranda from Local 87. And it was also shot down by the AFL-CIO. Now, the AFL-CIO sent a letter to the Labor Council in September of 2021 saying we don't have a right to talk about anything that they have taken up and that we should not even have a vote on it. So we got hit on the head with that. And at the CWA convention in 2021, we tried to, I did a friendly amendment to Biden's PRO Act. I don't know if people remember the famous PRO Act that Biden was touting as being very pro-union and supporting union development and funding unions and protecting unions and all that kind of stuff. And we were told, you need to support this as delegates, and said, okay, fine, let's read it. The day came when we were handed it on the same day of the convention, which at that time was a Zoom convention because it was in the middle of the pandemic. And I read it and I noticed that it did not have any kind of OSHA protections, Office of Safety and Health inspectors. According to the actual website of OSHA, national website, there was only 1,750 or 1,900 OSHA inspectors for the entire country. So I added a part to the resolution, a friendly amendment asking for demanding more OSHA health inspectors, the hiring of more OSHA health inspectors, as well as whistleblower protections. which passed. It did pass. But apparently nothing has been done about it. During the 4 years of the Biden administration, nothing was done regarding any kind of safety and health, taking into consideration that we had just gone through a friggin' pandemic, and there were nurses around the country who were wearing garbage bags because there was no protections, no personal protective equipment for COVID. So that also brought to mind the fact that we have to start taking control of our own future in terms of what are we going to do about this. It's not only, I mean, I obviously I think lobbying is not enough. My union's leadership used to be a union that was openly supportive of Bernie Sanders and openly supportive of Medicare for all, and openly supportive of Palestine, because we did pass a resolution on Palestine in 2021. But then they decided during this next round to prioritize contract negotiations instead of talking about Palestine. Now, Palestine, we have healthcare workers, more than 1,000 that have been killed, 1,400, more than 500 that are continuing to be in jail, that are part of the 10,000 Palestinian hostages being held by Israel now, and a genocide that continues. And I believe that things are very connected, because we have right now in the streets Gestapo killing and putting and kidnapping people off the streets and using typical Israeli tactics. Now, that's not a coincidence. There's a large number of people who've been trained by the IDF, trained by Israel, and it's been going on for decades. Jewish Voices for Peace put out a report about 5 years ago documenting this, called Deadly Exchange. So our money is not going where it needs to go, obviously. It's going to actually repress us and to do union busting on us and to create the conditions where any public sector is basically becoming so run down and unsustainable. So we need to do something about that. And lobbying is not enough.
And you're absolutely right, Elizabeth. And I just want to thank you and commend you both for your bravery and for taking us back through this neoliberal model that's forced us into the position we're in today. And I think your comment about defunding of public safety nets goes a long way. And everything you've talked about today is supported by that. So thank you. Is there anything you'd like to say to wrap up before we move on to Cheryl?
No, thank you so much for being patient with me.
Yes.
I was all over the place, but I was trying to tie
You,
things together,
you have tied it together. Thank
Okay.
you. Very well. And Cheryl, you're up.
Hi. So
Hi.
hi, everyone. So my name is Cheryl Thornton, and I work in the Department of Public Health primary care clinics. So there's 11 primary care clinics in the city of San Francisco within our safety net. I've been working for the city for 30 plus years, and I've seen it go from some people having Medi-Cal through linkages, to then it almost becoming everybody being able to be eligible for Medi-Cal, and then to what we are now, that many people that are on Medi-Cal are being threatened because of the big beautiful so-called bill. So what my experiences has been is, over the years, I have seen how the healthcare system is breaking down. We don't have enough primary care doctors. Unfortunately, when we went into the electronic medical record after Obamacare to give people more equity, a lot of the people in the healthcare system, there just was not enough resources. So a lot of the doctors have just gotten out of primary care because the work is just too overwhelming. And as far as so there's that. So we have more people that are waiting to see a doctor than there's doctors to see those patients. So many people, by the time we get to them, they may have stage 4 cancer, or whatnot, and they just, end up dying. We have like really bad healthcare outcomes, health disparities, because people are not able to get preventative care. Now, what really strikes me as really funny is that we are the only industrial nation that does not have a single payer, which I don't, it's actually breaking down the healthcare system by us not having this single payer. Um, I what I'm seeing and witnessing, I'm witnessing the whole healthcare system, at least in the safety nets, unravel. And it's even happening in the private sector. I take that back because, like, I have Blue Shield insurance, and the authorizations process is getting tighter and tighter, and it's getting harder and harder to get services that we are actually entitled to. So what I see is, last year, to go on, there was a hotel strike here in San Francisco. And one of the things that the workers were asking for was around healthcare. But the cost of healthcare was so exorbitant that, there was a big fight. Finally, Lori was able to strike a deal of some sort and get the hotel strike resolved. But one thing the head of the Labor Council said, that such a challenge for our labor costs because of the healthcare costs. Now, this particular year, I think they said all healthcare is going to go up by 10%. And so I feel like this is an opportune time to try to wake up the masses to say, to want to get educated and say, we need something different. It doesn't mean we're going to be a communist nation because we have a single payer. And I just, I don't, America, I mean, we can't keep on this track that we're on because it's a failed system. We're in a decline. Capitalism is going down. So, if this nation is to survive, we are going to have to come up with some affordable health care for all. Otherwise, it's just going to break the whole entire system. And I know San Francisco has come up with this CEO tax because, as Brenda mentioned, there's a big deficit to the tune of almost $1 billion here in San Francisco. Um, and so they're trying to get the CEO tax passed. Department of Public Health has to cut $400 million this budget season. But the thing about the CEO to bring 100 million in. That is not going to be enough. That's just a stopgap measure for now until they can figure out the percenters, how to do change management, how to bring more lower paid workers in to contract out our jobs so that they can keep this system going, this failed system. So, and next year, they're already projecting that the deficit will be bigger than $1 billion. So see, that CEO tax, that's a stopgap measure. It's not going to solve and resolve the problem. So I'm just very supportive of having a single payer, so everybody can get access to good quality care. I mean, it's just excuse my language, a damn shame that in Cuba, they have better health outcomes than they do here in the United States, and it's because the way that um, they provide the health care, and so they really focus on in Cuba preventative versus just waiting for someone to get sick and go to the doctor and and then I guess die or just get more and more sick. So it just seems like we could do something. If Cuba, as poor as it is, can do that, why can't we? So that's pretty much what I have to say.
Cheryl, thank you. And, we really appreciate you pointing out that we're the only industrialized nation without national single payer. We need it. And educating the masses, as you brought up, is very important. So I hope we can talk a little bit more about that. But thank you so much. And we'll move to Desireee.
Hello, everyone. Thank you. It's an honor to be in your presence. My name is Desireee Rojas. I am a longtime LACLA member and previous president of the Sacramento chapter. And without many people said covered a lot of important information. I don't want to repeat any of that, but I'm going to basically come in hard here. What is happening in our country today? Not only is it a criminal, it's absolutely criminal to even try to introduce acts or bills or legislation. You call it what you want. I call it no mercy healthcare bills. Laws, no mercy healthcare. And what it's saying, really, the message is that we are not going to support a single payer or national healthcare in this country because in our best interest is not the American people, it's not children, it's not veterans, it's not students, it's not the working class, it's not the elderly. It's to continue to line the pockets of investors and those wealthy. I'm not talking millionaires. See, millionaires are not wealthy anymore. I'm talking about billionaires. Billionaires to basically continue to line their pockets. Here's the issue. And we all know that we have the Federal Healthcare Act, the Federal Healthcare, right? The California Care Act. We all know that there was an expiration. The enhanced premium tax credits have expired. We know that the power is in the hands of this diabolical Trump administration who wants to introduce his idea of the great healthcare plan. We can only imagine what that really means. Of course, it's not going to include immigrants. And it probably will start cutting money and any kind of clinic services and subsidies, not only to rural areas, but to indigenous communities. So what to expect? We don't need to brace ourselves. I think we know what to expect. But I think it's very important that we all understand in all of our states what federal and state matching funds looks like. In California, the ACA is partnered with Medi-Cal. Okay, we understand the adjustments at the federal level have not been adjusted here in California for the cost of living, which has forced a lot of elderly to be graduated out of the program. And Governor Newsom and Governor Brown and the previous governors, I think since 2006, have not made any of those adjustments to allow people to stay in the program, which would also allow them to have be qualified for an in-home care worker. They have not made this adjustment. And the reason why they haven't made this adjustment is because they are satisfying the appetite of their donors and their investors and insurance companies. Okay? Governor Newsom, we all know that he has pushed the SB 770, right? But has AB 1400 been passed? We know that the California Nurses Association wants to move forward, and it's going to start, is organizing now on California Guaranteed Healthcare for All, CalCare. But let's be frank here. What we're talking about right now, what is taking place in this country, is an elimination project. This elimination project is about disappearing people. You use your own imagination. We know that they're doing it through ICE. We know they're doing it through private prison industries, jail and civic corps. We know that they're attacking the brown people, black people, immigrants, which which I don't believe, nor did my father, Al Rojas. We don't believe we're illegals or immigrants because we're standing on our land. We are the original people of our land. We are the indigenous original people of this continent. Europeans invaded our land. We stand on our land. How could we be illegal or any other human being be illegal on planet Earth? We're literally paying billions of dollars in taxes to live on planet Earth. Does that make any sense? It doesn't. Because this elimination project is about pushing no mercy legislation to go after the workers, the working class, and our independent and organized and unorganized labor forces in this country. And our fight back, even if it has to be done at the independent level, has to be done at the independent level, because the AFL-CIO has been very quiet. Our nationals have been very quiet. What about the Labor Federation? Mm-hmm. Where's Gavin Newsom right now? Mm-hmm. My mother lost her Medi-Cal. She lost her in-home care worker. For what? A federal increase of $150 after taxes, which what she ended up with, what, $35, $75 over, but she graduated. Listen to the terms, how kind and nice. Graduated her out of the program. Thank God she had 4 children that would supplement her health care. But let's not get too carried away here. Let's talk about dental. There is no dental health care in the country or in the California. Every time my mother needs to get her dental work done, there's a care plan credit card on every office of every dentist office, a maximum of $2,000, and then it doesn't miss every time. Her bill is always $2,000, the exact maximum of that credit card, with a 24 to 36% interest rate. Who's making the money here? Mm-hmm. We're the richest country in the world, but we're being overworked. We're being eliminated through an elimination project in order to sustain the billionaire, the wealthy, investors. Yeah. So here's what I have to say further about this. This class protection, this wealthy class protection, when we're talking about this bill in California right now, or an act, it's a one-time 5% increase for billionaires. And Governor Newsom right now is very quiet about this bill. Why? Because right now, behind the scenes, all these billionaire investors and these billionaires, these wealthy families, do not want to pay just the one-time 5% billionaires tax. Can you imagine? It's just a one-time. Immigrants paid more taxes in this state than any billionaires ever did in this state. And I'm talking about all of the corporations behind the H-2B program. The H-2B program that allows all the let's just say the high-tech industry let's see, workers of the exterior, international workers to come in with, they get visas and they get, they get paid a lot of money to come and work in all these high-tech Silicon Valley jobs. But these are not the people that ICE are going out to look for. These are not the people that ICE is busting their car windows in. No, ICE today, as you know, are busting in the windows of cooks and janitors and mothers and students. People who are on their way to work. They're not the criminals. So whose appetite are we really fulfilling here, other than the billionaires and the wealthy families and investors and this administration? We are in a very serious position here. And the position that we are in now is we have to accept the fact that we lost. We lost because we have allowed a two-party system to dictate our politics in our country. A long time ago, we should have already formed a third party, a workers' party. We haven't done that. But today, our fuel and our motivation, number one, should be to take care of ourselves and our families, and also to organize in our communities, understand who lives in our community, who needs assistance, who's disabled, who's elderly. In depression, this is the way we function in the barrios and the colonias and inside of the working class poor communities. We kept track of who was our elderly neighbors, who are the children. We were all one community tribe, and that is what we have to fall on, because no one is going to save us. But getting back to this wealthy tax bill in California, this is very important to pay attention to. It's very important that everybody, it doesn't matter whether you're tied to labor or not, everybody must get behind and work with the California Nurses Association behind CalCare and in your state. You see, in California, we call it a different healthcare term than Mississippi or Georgia or Pennsylvania. You know, there's the federal ACA, but each state identifies their state's healthcare plan differently. So everyone needs to understand what that is and where they can start organizing behind whatever legislation that will give them single payer. But the reason why the pushback has always been in California first is because historically, when we pass legislation, there's a domino effect in the rest of the country. We are the fourth largest economy in the world. And if we can get single payer in this state, then the rest of the states will be able to get it. But here's what they say. If you want something to be killed in at the Capitol, just send it to the Democratic Party. They'll kill it.
Well, Desireee, I want to thank you because you have given us a very hard-hitting message tonight. And I think we've all learned something by the various topics you've covered. And I love your billionaire pocket lining quote, and I will use that again. So I just want to say thank you very much. And now I'd like to turn it over to Anna Malinow.
Well, it's never a good idea to follow Desireee Rojas as a speaker, just because I'm sure to disappoint. But at any rate, I really want to thank all of our speakers, Elizabeth, Cheryl, Desireee, and sorry,
Brenda.
and Brenda, yes, Brenda, our first speaker, as well as Senior Disability Action, Ligia and Grace for organizing the meeting, for coordinating this, Devra for being our wonderful facilitator. Thank you, keeping time. So I'll try to go really quickly, as well as Steve for organizing this panel for us. So, so many things that people said. I don't need to repeat them because They're really, really fantastic. So what I'm going to do is, first of all, my name is Anna Malinow. I am a retired pediatrician, and I worked as a pediatrician for 30 years, taking care of underserved children in Ohio, in Texas, in Pennsylvania, and most recently here in California. And I'm also one of the past presidents of Physicians for National Health Program. I'm currently on the steering committee of National Single Payer and one of the lead organizers for the movement to end privatization of Medicare. And Senior Disability Action is hosting these teach-ins to do exactly what we are talking about, which is we have to wake up the masses, as Cheryl says. We have to educate the people, and that's what we're here to do. That's what these teach-ins are doing. This is the third teach-in that we've done. The first one was the one about the U.S. healthcare system called It's Not Normal, right? It's not normal. The second one was on the ACA subsidies, between a rock and a hard place, and what did the subsidies mean, and why was there a federal shutdown over the subsidies anyway? And we're obviously heading in the same direction again, right? On January 30th, the budget is going to be up again. And if we don't pass a budget, then we're going to go back to the way that we were in October for a federal shutdown. And it might very well be over the subsidies. It would be great if the Democrats could hold the ground and make it about ICE, but I have very little faith that that's what they're going to do. So at any rate, what am I here to talk about? First of all, I just want to wrap up that, obviously, to remind everybody that on July 4th, 2025, President Trump signed the 2025 Federal Budget Reconciliation Law, H.R. 1, which has been known as the Big Beautiful Bill. I've been calling it the Big Billionaires Bill, but from now on, I'm going to call it the No Mercy Bill. I love that. That's really what it is. It is the No Mercy Bill. It was touted to cut waste and to secure the borders. It slashed almost $1 trillion over 10 years from Medicare and Medicaid. And these are programs that affect 130 million Americans, right? Many of us here in this room are relatives who rely on these programs for their healthcare coverage. Now, the Congressional Budget Office has said that the combination of the cuts for the wealthy, because that's what these are, cuts to the wealthy, and spending cuts will add $3.3 trillion to the national deficit. So while billionaires get wealthier, and by the way, this billionaires tax shouldn't just be a one-time thing, they need to be taxed hard and every single year, not just, once every, for 5 years and then that's it. At any rate, while billionaires get wealthier, millions of people will lose their health insurance and thousands will die. Hundreds of thousands of healthcare workers will lose their jobs. Hospitals will shut down either services or shut down entirely. And the communities of those hospitals and where those healthcare workers live and where those patients live, of course, will suffer. Now, there is an urgency right now. And why is this urgent? Well, there are three things that are, I think, really working for us to go on the offensive, which is really the best defense. So the three things that are happening right now is, yes, the enhanced subsidies in the marketplace have expired. And we know that premiums are going up sometimes by thousands of dollars every month for millions of people. Number two, premiums in the employer-sponsored health insurance piece of the pie, if you guys remember, covers about 154 million individuals. Those premiums are going to be skyrocketing as well. As it is, last year, it cost a family, an average family, about $26,000, which is the cost of a car, to pay for health insurance. And these are premiums that the workers are paying, and these are premiums that the employers are paying. Now, employers pay the larger share of those premiums, it is true, but we know that those premiums are just deferred wages. So instead of going to the insurance company like a poll tax, those should be going to increase the wages of our workers. But that's not what's happening. And finally, hospitals are going to go through this tremendous shock as a result of the loss of Medicaid funding. As it is, over 300 hospitals are at risk for closing, many of them in rural areas. So we really are in a moment of great urgency, and all of these things are working together so that we can actually take this moment and demand a national single payer, improved and expanded Medicare for all, free from profit. And that has to be key. We have to have public financing. We have to remove the profit. It has to be funded progressively through progressive taxes, according to your ability to pay, so that, yes, the billionaires are going to be paying a whole lot more than people with minimum wage or, with a living wage or a non-living wage. And we have to remove the profit, and we have to remove all the out-of-pocket costs. We have to remove the premiums, the copays, the deductibles. All of that has to be gone. And yes, our taxes will go up, but they're not going to go up as much as what we're going to be saving from having a publicly financed healthcare system that removes profit from the system, plus all the administrative costs that we will be cutting from the system. And it's all this administration that is required to generate the profits for the insurance companies. What is this going to give us? It's going to give us freedom to choose our doctors. It's going to give us freedom to choose our jobs so that we're not in job lock anymore. It's going to be freedom for, a woman who wants to leave her marriage. It'll give her the freedom to leave, not worried that she's going to be losing her health insurance if she leaves an abusive husband. And it's going to give providers, nurses, doctors, therapists, those practitioners, the freedom to practice the best medicine possible. So please join us. The next time that we meet is going to be February 12th. We need to continue this mass education effort because we need to educate everybody. The good news is, I've given you a lot of bad news. We've heard a lot of bad news. The good news is that the public is behind us. Oh, just about 75% or so of people in this country support an improved Medicare for all. 78% of Democrats, 64% of independents, and get this, 47% of Republicans support Medicare for all, even if it means increasing taxes and getting rid of their private health insurance. So that's the good news. That battle we have won. Now the next battle is to achieve a national single-payer healthcare system free from profit. So see you all on February 12th, which is our next teach-in. And I think that Grace is going to put the link in our chat so that people can click on that link and register for the next teach-in. So I'm not sure how much time we have for questions. I'm happy to stay here for a little longer.
I also put the evaluation link, and I'm going to share it again, and I can put the registration link as well.
Thank you, Lihia. And Anna's talked about the February 12th teach-in. That'll be Medicaid under fire. What is Medicaid and how do cuts affect everyone? The link is there if you want to sign up. January 31st, there will be a rally at the Harry Bridges Plaza in front of the Ferry Building at noon as well, if you're interested in participating.
You might want to mute Steve.
Steve,
Yeah.
mute yourself, Steve. Yeah.
Okay. And I will ask if you have a question for one of the panelists, please raise your electronic hand and we can open it up for a few questions if people have time.
I think we should, go more than a few questions. We have time to go at least 30 minutes, I think. So anyway.
Okay.
I was going to say, we have to look at the situation we're in because we've got a fascist government. And what's going on in Minneapolis right now is that they're terrorizing the entire population, including healthcare workers. They're going into hospitals and pulling people out of healthcare, out of the hospitals. They're chaining people who are injured, to hospital beds. It's a fascist occupation of Minneapolis. And that's coming to San Francisco. It's coming to, and it's been in Chicago and Los Angeles. So this is what we're facing in this country. And I think what we have to do at our rally is tie these struggles together. The struggle for healthcare is a struggle against what's going on in this country, that we're spending $1 trillion on the military, and they want to increase it 50% next year. And our unions, and this is what we have to bring up, business unionism is not even mentioning that. They talk about contract fights separate from the massive attacks on the budgets. The budgets on healthcare hospitals in California are going to be massively attacked. And you have the governor, as people pointed out, saying that he's opposed to a billionaire's tax. So we have to get our members, our unions and workers, and say the billionaires, the billionaires have to start paying for this thing. And it's only going to happen when people go out on the streets. My view is national health care is going to happen when millions of people go on the street and say, we have a right to health care. That's when it's going to happen. And that's what I think we have to fight for. And we have to bring the voices of healthcare workers and patients who are losing their healthcare to the rallies that we're having. I hope we have one in Sacramento as well as San Francisco. We're going to have one. Thank you.
Thank you. We've got a question from Valley Elsa.
Thank you, Deborah. And thank you so much to all of our panelists. And I would really love to hear, especially from our panelists that are currently working or previously, all of you have worked in healthcare, so you're all able to answer this. But I would really love your perspective on how we energize and support healthcare workers to take part of this organizing with us. And this is something I talk about with Anna all the time. Christine, my wife, is in this call. She's a MS2 at UCSF, so she's a medical student. And something that we're really struggling with, so Christine is one of the officers for students for a national health plan at UCSF, is, the medical students get really overwhelmed and busy. And of course, that's even more true for the residents, right? That's why they have their name, because they live at the hospitals. And I just really want to know, based on your perspectives, like how can we make it easy for these workers to plug in and actually organize? Because I know most of them are behind this, but how do we do it in a way, when everybody's so overworked, things are understaffed? I would just love to hear some creative ideas around that, because I think if we can figure that out, then, we'll get everything that we want, but we have to figure out ways to make it easy for them to plug in. So we'd just love to your insight on that.
This is Brenda. What I think about that is, because our residents got unionized, right? So, and that was after years of us talking to them and them seeing our activity and all that. So I almost feel like it needs to be in the workplace. But I think as with UCSF and other places, they are penalizing people. They really are. They're penalizing people, and we need to do it in the workplace. And we need to support each other in the workplace. And all healthcare workers need to support each other. And we have to stop this division that, it's people use terms like the doctors, the nurses, the clerks, and we have to realize that we're all healthcare workers, and we need to move that way.
Thank you. Appreciate your comments, Brenda. It looks like Elizabeth wanted to make a comment.
Yeah. It's a hard road to deal within unions, because you're dealing with union bureaucracy. And of course, the union bureaucracy is designed to make things more difficult for people to step outside of the box and do things beyond what they believe is necessary. Obviously, union bureaucracies, when I mention union bureaucracies, I'm mentioning something very specific. The AFL-CIO in particular has been the right hand of U.S. foreign policy and the right hand of neoliberal policy for quite some time. When I say the right hand of U.S. policy, I'm talking about even from the 1920s, the American Federation of Labor, for example, was in Palestine and supporting the development of an apartheid state. okay, from the 1920s. In Chile and other parts in Latin America, the AFL-CIO created the American Institute for Free Labor Development, which was used as an intervention arm in any kind of progressive movements that were going on in Latin America, including helping to overthrow Salvador Allende. The reason I'm bringing this history is because many workers, many young workers, are only beginning to realize about this history, and they're beginning to question their union bureaucracy and their leaders. But there is still a long way to go, because they see whenever anybody speaks up, like I do, we get marginalized. I'm just going to give you one clear example. This last union convention of CWA convention that we had in last August, I ran as UPTE Members for Palestine to be a delegate. I had been delegate previously several times in CWA conventions. Because of the number of our members, 22,000, we had allotted to us up to maybe 24, maybe even larger, 24 delegates, right? The union leadership of my union decided, the executive committee made a vote and decided, without any notice to workers, that they would only have 4 elected members as delegates to the CWA convention. 4, not including the president. I still ran. I got in 5th place together with one other person from UPTE Members for Palestine. I still went to the convention. I couldn't even be an alternate. Okay, that's just like the tip of the iceberg in terms of the level of marginalization that happens. And many workers feel they get chilled. They get intimidated by that when your own union leaders marginalize those of us who speak up. As also, some people were treated very badly and suspended and marginalized, even within movement spaces, for speaking up for Dr. Ruba Myra at UCSF, who was fired, okay, because she dared to question the fact that are any of these Israeli doctors that might be coming back from committing genocide there, ones who openly say that they have served or serve in the IDF? Do we want these doctors to come back and treat Palestinian or Arab patients or Muslim patients? That's all she said. She was not calling them anything else except for the fact that serving in the IDF is obligatory. So it wasn't calling anybody any kind of, it had nothing to do with anti-Semitism. It had to do with the IDF and with Israel, which is committing genocide, and the people that are committing it need to confront justice. So people step back. They don't want to be marginalized, but we need to support each other. We need to stand up, and we need to not, any kind of difficulties that come up, we cannot be closing off to any discussions. We have to be willing to confront our differences as well and talk to each other instead of, closing the spaces,
We have a few more.
Yeah.
Sorry.
Thank you, Elizabeth. And Cheryl, did you want to respond to Valley Elza's question?
Oh, yes. I just wanted to say that we real short is that we should connect single payers as a clinician survival and patient safety ideology. Also, we could host lunch and learns on single payers and health equity. Invite patients, nurse, and social workers and eligibility staff to speak. This is what we could do with the residents. Tie single payer to burnout and moral injury and administrative waste. Those are some of the things that we could do. Like when you say residents can get involved, because they can't keep up either. They're burning out. As you said, the residents, I see it with the primary care doctors. They're leaving the healthcare system because they're burning out. And so we need to tie single payer to the burnout.
Thank you, Cheryl. And we've got a question from Yusra.
Thank you so much for taking my call. I really appreciate all the speakers. Everyone's been awesome. My question about the tax bill for the San Francisco, the billionaire tax bill, why is it a one-time tax bill? I mean, and not a continuous annual tax that needs to be implemented so that it actually appropriately fund an ongoing universal health care. Does anyone have the answer to that question?
Yeah, because the union bureaucracy support capitalism. The AFL-CIO and the unions support capitalism. They support the Democratic Party. They don't want to put working people in charge of the country and the world. Therefore, reforming capitalism. And I mean, it's important. I met with a senator in San Francisco to ask him to support a oil depletion tax to fund education. And he told me, why don't you get signatures to put it on the ballot? I mean, Alaska, Texas have an oil depletion tax, but that's the reason. The unions don't want to go to war with the billionaires. I mean, Newsom, for example, the unions are not attacking Newsom. Newsom is not quiet about this billionaire's tax. He's against it. He's organizing against it. And the union should be attacking him. They should be chasing him around. Like the nurses chased him around. They chased him all over California. Schwarzenegger, rather. They chase Schwarzenegger around. The unions have to be aggressive and go after these capitalist politicians. That's it.
Thank you, Steve. And I think Desireee wanted to comment on that question from Yusra.
Yes, I'd like to interject here. Steve, you're absolutely correct, but I think it's key. Going back into history is very important, but what's key is to stay on the offensive. And when we're staying on the offensive, we're developing strategy about how to move forward and how to organize forward. Otherwise, we get so caught up in the past. We have to stay current. What's current? The offensive strategy is that these class protection rules for the billionaires are not serving the working class. And answering your question, people in the medical industry, they're overworked, they're tired, and those who are on the front line of the union are superheroes. I know one of them. My sister is Melissa Johnson. She's out there on the front line in the nurses union, and a lot of nurses doing great work. But there is a fracture in the system. Nurses, doctors are leaving, but also specialists in the field cannot compete anymore. And so they're being sucked up by larger hospitals, which means they're becoming overworked, right? And it's because it's expensive to go to school. So we know that the system is not working. So what is the solution to this? In my opinion, we have to depend on the people, the working people in the public and in our communities, and in partnership with any union or anyone who is willing to listen and to organize in line for single payer healthcare. We cannot say that this is a part of labor only anymore, or for the most part, labor. This is a people state of emergency issue. And where we should be attacking like junkyard dogs is also the media. The media lives inside the same donor system. And we need to create a donor system list behind this governor to say, listen, I'm going to say it in nice terms. Listen, honey pie sugar bunch, your donors, whoever they are, we're going after them. Who we haven't talked about enough is the telecommunication. AT&T and all of them make so much money. Have we audited them to find out how much money they're making? And here's my message to all these billionaire corporations that want to leave California. Leave. We don't need you. We'll replace you with, how about this? How about a membership ownership into driving a business to replace you? The people own that. How about we start thinking collectively that way? Like they created the people's banking system. Let's start creating the people's system of everything. You want to leave? In-N-Out Burgers, say la vie, adios, goodbye. We'll create, California, we'll put a nice name on it, burgers. And every employee who works in that industry can own a piece of that industry, and that industry can pay for their health care. We need to start thinking creatively, and we start strategizing on who this donor system is and start going after them. Because once we apply that pressure and apply the pressure to the media that lives inside of this wasp, not a wasp nest, this viper nest, we need to go after them as well. And that is my opinion. It is offensive, get off of the defensive, and bring everybody involved. Anybody who cares, everybody has to be a part of this. This is the number one issue that should be on every campaign, in everyone's campaign. If you do not believe in single payer, if you do not believe in shutting down the industrial war complex and money leaving to other countries and not being spent in this country, that no one should be voting, let alone endorsing those candidates. And that means getting aggressive with our central labor councils and anybody who is using the same walk like the duck, talk like the duck, and bite like the duck democratic politician that it falls into line. Those days are over. We have lost. Now it's time to win. And the only way we're going to win is by collectively becoming more strategic.
Thank you, Desireee. And Elizabeth, did you want to comment on Yusra's question?
Yes, I did. I want to mention it's not just the path that we're talking about, but also because the American Institute for Free Labor Development now is called Solidarity Centers, and they're very, very much active, and they're still active. And at the same time, also, I wanted to talk about the solution of what Desireee was talking about, community labor partnerships, because, for example, I don't know if people remember the April 29th strike that happened with the teachers union, the Oakland teachers. They formed Schools and Labor Against Privatization together with the ILWU. The ILWU was at the same time fighting against the takeover of Howard Terminal, or the guy from the Gap, Don Fisher, wanted to buy the waterfront properties and create an Oakland A stadium, and they would have taken over Howard Terminal and all that kind of stuff. And at the same time, Don Fisher was also one of the main people behind the privatization of schools and the promoter of charter schools and the defunding of public education. So we're dealing with people who are attacking us in all fronts. And so we need to be able to unite in all the different fronts and create valid community labor alliances. Okay, that's what's really important that we need to do. Yeah. Things have shown, those have been proven to work,
And we thank you, Elizabeth. We've got a question coming in from Joni Grassi.
Hey, hi, everyone, and I really appreciate all the speeches. I feel pumped up and ready to work. I have been in this movement for over 15 years, and I have supported every single CalCare bill. I'm a retired nurse. I was a part of CNA, but the main complaint I hear, and I want to speak to all of the union people, anybody who's in a union here tonight, is your union coming to the table to support CalCare? The main complaint I have heard over the years is the CNA, my own union, was not, I don't know what the word is to use. They did not allow other unions in on the writing of the bill, and other unions said, unless we participate in the authorization of the bill and what's in it, we're not playing. And I love Desiree's comments about let's pull it together, let's build these bridges. Are you going to show up, and are you going to try and make your upper management people show up? Because they aren't, and it's gone down. I have been to so many hearings up in the Capitol and fought and fought and fought. You name the number, I've been there. And I will support this new one, but I'm very worried. I do hear the California Teachers Association might be on board this time, but we need everybody and everybody's union. So anything we can do to help get that going, let's build the bridges together. I would love it. I'm getting old. I may not see this in my lifetime. Let's go. Thank you.
Thank you, Joni.
Hi, this is Brenda.
Yeah.
To that point, because I'm also one of the political chairs for San Francisco for my union. And I do, when she said that, that brought back memories. And I do remember that our union was trying to be in the negotiation. I do remember there was this big break between CNA and us because they were meeting with them and leaving us out. They were writing the legislation and didn't want us to alter it in any way. And so, yeah, they did walk away. We did walk away. So she's right. But
Brenda, thank you.
it shouldn't end with that, right? That shouldn't be the end of it. I mean, we have to stop being so anal, right? That might have happened then. Maybe we still need to talk about the things in it that we didn't like.
That we are really trying to improve is the bilingual pay, if folks remember.
Thank you. Desiree, you've got your hand up? Did you? No? Okay. Are there any other questions for the panelists this evening? No. Well, again, just I'll wrap up and say thank you for joining us. I hope you'll be with us February 12th. I hope you can come out to the rally on the 31st of January at the Harry Bridges Plaza. Have a great evening.
Thank you.
Thank you.
Thank you.
The registration link is in there and the evaluation link also. Just so please, if you can register or
I wanted to tell people that I put in the chat the link to HR 7006, which was recently passed, unfortunately. And I also put in the chat the UC financial report that had been put out by the AFSCME regarding the $1 billion of profits that UC has been making.
Thank you so much, everybody. Yeah, we'll take a look at that.
Yeah.
All right. Good night,
And
everybody.
also, sorry, also the labor education project on AFL-CIO international operations is also there. The link is there as well to give information regarding what the AFL-CIO has been involved in.
Thank you, Elizabeth.
Thank you.
Thank you, everybody. Good night. Bye-bye.
Good night. Thank you.
so much. Good night.
Good night. Bye, Pam. Bye, Deborah.